So thank you, Dr. Sacha, for taking your time, joining this Zoom meeting, and thank you, Nancy, for giving us this opportunity. Let me introduce me shortly. My name is Ziba. I am founder of our medical global health tourism company, and today we will be discussing an advanced treatment for heart arrhythmias called ablation, which is available in Swiss Ablation Center in Switzerland, Zurich, and I am proudly joined by Professor Dr. Sacha from Swiss Ablation Center in Switzerland. So, dear doctor, I have received many questions from people all around the world about this ablation. So let's start from first one. What are heart arrhythmias and how can they affect a person's health and daily life?
Yeah, that's a very important question.
Yeah.
Basically, you do not usually feel your heart. Any normal person, either when they run, the heart beats fast, or when they relax, the heart beats slow. But that's all we feel. When a person has an arrhythmia, the pulse is not regular. And so you feel the pulse, or you feel it here, or you just feel it in your body. It's irregular. And this causes symptoms. It can be either too fast or too slow, but the arrhythmia is often noticed by patients. But about in 30% of cases, arrhythmias are not noticed, not detected. And that's why it's so important to do a checkup and to see if you don't have any arrhythmias.
Okay. So next question, most requested question. What is surgical ablation that doing in many hospitals and ablation that only you perform, which is available in Swiss Ablation Center?
Okay. So the word ablation is generally a term we treat a tissue and we change its characteristics. And we know that arrhythmia comes from the heart, and this is the back of the heart, and these are the 1, 2, 3, 4 pulmonary veins. And the aim is to create a scar here, there, and there. And this is the basic treatment for atrial fibrillation. Atrial fibrillation is the most common cardiac arrhythmia. So you have different forms of ablation. Normal catheter ablation, you go through the groin, down here, you go into the heart and you do an ablation inside the heart.
Okay.
We do these every day in our center. This is a regular ambulatory procedure. It can be done either with cryothermia, which is cold, so we use cold to burn the tissue, or we could do it with radio frequency, or we can do it with electricity. This is pulse field ablation. This is the newest form. These are the ablations from the inside. But in complex forms, we can also do surgical ablation, and that is from the outside. We go through here, and we do that ablation on the surface of the heart. But this is for a minority of patients. I am specialized in that. I've been doing that for 15 years. However, most of the patients whom I see, they don't need the surgical ablation. They need a normal catheter ablation, which you do here.
Perfect. So next question, what type of arrhythmias can be treated with ablation that you are doing in Swiss Ablation Center?
Okay. We treat all arrhythmias. And all arrhythmias being from simple extra beats. These are called PVCs, ventricular extrasystoles. And the most complex part is ventricular tachycardia. And the most common is atrial fibrillation. So we treat all arrhythmias which are available.
So next question, who can be a good candidate for ablations that only you perform in Swiss Ablation Center without surgical?
Basically, it's any patient who is fit enough to travel to Switzerland to come visit us is a good patient. If they are too fat, too big, a BMI above 40 is too high. We cannot do this in our center. For that, you have to go to a big hospital. And basically, it's really all patients who are fit enough to travel to Switzerland, we can treat.
Okay. So what kind of anesthesia is used during ablation and how long does procedure take?
Yeah, so it depends on the procedure. Some procedures, like in young children who have tachycardias, we need them to be awake because the autonomous nervous system, the stress, causes the arrhythmia also. So if we put them to sleep and they're under general anesthesia, we don't see anything. So some procedures are done awake with local anesthesia, but most of the procedures we do in general anesthesia. We have a team of anesthesiologists who are here and who put the patient to sleep during the whole procedure. And the most common question I have from the patients after surgery is, are we finished? Is it already done? So it's that.
Oh, so
The
good.
procedures take anywhere from half an hour to an hour and a half, but
Oh,
not longer.
perfect.
And we streamline all our treatments because we know we have to send the patients home in the evening. So we don't give them too much medication, and anesthesia is always just enough that they sleep and don't move, but not so much that after they sleep for 6 hours.
Perfect. So what risks or any complications may patients have about this after this ablation procedure?
Well, risks and complications are part of medicine. However, we have an ambulatory setting, which means all our patients go home in the evening. If we would have bad results, our patients couldn't go home in the evening. We have very little complications. And that is due to the fact that we are all specialists. My team, we are all proven specialists with a track record. We've been doing this for more than 10, 15 years. We don't have to learn it anymore. Most often when you go to a hospital, there are young doctors there who need to learn. It's normal. I also had to learn it.
Yes.
Now we don't have to learn anymore. So I'm not saying that mistakes don't happen, but the occurrence of these can be minimized by professionality of the team. And we have a team which is really, we're all specialists and we're all working for the patient. However, it's medicine, so you never know. But I mean, we have never had a grave complication in our center, so I'm very proud of that. And we are audited by the Swiss government every year in regards to our results. We have to publish our results in a national database. So these numbers are clear, and we have 0 complications for the last 2 years in the official database.
Perfect. And how long does it take for patients to recover after the procedure?
Well, the physical recovery is very quick. This morning I saw a patient, a Canadian. He had an ablation yesterday. This afternoon he was going to take the train and go to the mountains and go for a walk. So it really depends on the patient. Recovery is very quick, but it can also be a bit more difficult. And for that, we also work with rehab clinics. If it's necessary, we can send the patients to a rehab clinic afterwards.
Okay. And will patients feel immediate improvement in their heart rhythm, or does it take for the full effects to be seen?
That's a very good question. Sometimes patients feel it right away. The Canadian this morning, he's been in atrial fibrillation for 2 years. We did the procedure yesterday, and this morning he was smiling and said, my heart is beating regularly. Some other patients, it might take a couple of days or weeks for the effect of the ablation to settle in. So it really depends on the disease condition and the patient itself.
Awesome. So what are success rates for ablation at Swiss Ablation Center?
I would say 100% because we have yet to have a patient who is unhappy. However, they are all happy. It doesn't mean that we heal them all. That's the problem. Medicine is not an exact science. The success rates for catheter ablation in paroxysmal AFib is about 80 to 95%. Sometimes a patient needs a second procedure. But then you have other forms of atrial fibrillation, like persistent atrial fibrillation. There it's more like 50 to 70%. It's very important that the patient also does all the lifestyle changes which we recommend and takes the medication which we recommend. The treatment is something punctual we do once. However, all the changes in lifestyle modification, all that continues afterwards. And we stay in touch with our patients regularly. And also through the solicitors, we keep close contact, we manage the medication. So, I mean, patients are very happy.
Perfect. Is it possible you to share latest success stories shortly, which you performed ablation?
Yes, I mean, I taped a video this morning of my Canadian patient from yesterday. It's going to be online on YouTube, I think on Monday or Tuesday. That's one. Otherwise, I also had a patient come to me from Cyprus who had a problem with his valve. I fixed his valve. I mean, I'm very proud to say this is my job. I'm a doctor. And every patient is a success story because we try to help, we help everybody.
Yes, right.
And we make a meaningful difference because these patients, they have symptoms, they have a problem, and we help them in solving or trying to solve their problem.
Good. Is your ablation procedure a permanent solution for arrhythmias, or might patients need additional treatments in the future?
Well, I don't have a crystal ball. So I always tell my patients 50% of patients I will never see again because they are healed. And the other half, it might be a bit more complicated. It means they might come back for a treatment, they might need medication, they might need surgery, they might need a pacemaker.
It depends.
That's the whole thing. Cardiac arrhythmias are complex. We are specialized in this, but some things are, sometimes we can give a lasting solution, and sometimes not.
Understand. What follow-up care or monitoring is required after the ablation procedure?
Well, this is very clearly stated by all the national guidelines. After a cardiac ablation procedure, whatever kind of ablation, you have a first clinical follow-up 1 month after the procedure, then 3, 6, 12, 24 months. And this is recommended by the big guidelines and standardized. But the follow-up doesn't need to be done with us. The follow-up can be done in the patient's home country. Any cardiologist can do this, and the results can be sent by email, and we can have a video conference and discuss the outcomes.
Okay. And how many days do international patients need to stay in Switzerland for this ablation procedure, especially people who are coming long way from South Africa, Canada?
So the Canadian patient whom I just saw this morning, he arrived, today is Thursday, he arrived on Tuesday in Zurich. He came to the office, we did a blood test and ECG. On Wednesday, not today's Friday, sorry. He arrived on Wednesday. On Thursday, we did the procedure. No. Anyway, you arrive on one day, we do the procedure, we do a follow-up the next day, and then 1 day rest and you can fly back.
Oh, that's cool. And what medical records should patients provide before traveling for treatment?
And excuse me, I didn't understand the question. Didn't hear you.
What medical records?
Medical records.
Yes.
Yes. In regards to cardiac arrhythmia, we need to see as much information which there is. So ECG, Holter ECG, implantable loop recorder, ultrasound, blood test, and whatever CT or MRI has been done. But this is something which we can also tailor. We can speak with the patient before he comes to see us, and we can recommend either some exams be done at home, or we can do the exams here, in which case I would add a day or two to the travel.
Good. Do patients need to follow any specific preparation or diet before ablation procedure?
No.
Nothing.
Obviously, I would not recommend to smoke. Smoking is bad. If you're overweight, try to lose some weight. However, a lot of patients who have arrhythmia can't lose weight because of the arrhythmia. So basically, there's no special precaution to take beforehand. Afterwards, yes.
Afterwards. And how about alcohol? Can they consume alcohol?
Well, again, it depends on the patient. Some patients are very sensitive to alcohol. They drink 1 glass and they get atrial fibrillation. Others can drink a bottle of whiskey and never have a problem. So it really depends on the patient.
And if a patient has tried other treatments for arrhythmia without success, can ablation procedure still be effective?
Exactly in those cases, ablation procedures which we perform are very successful because we can assess what has been done before, and we can complement the treatment and use our special skills to obtain the best result for the patient.
What support is available for international patients during their stay in Swiss Ablation Center?
So we have Nancy and her team who accompany the patients during their stay with us. Our team speaks many languages, and that is something which can be tailored to the patient's needs.
There is...
I mean, it can be a driver to pick him up at the airport. It can be a translator. It can be, we have the possibility to organize everything.
Okay. Yeah. So this is the most requested question I received, that people wanted to know approximate cost for ablation procedure. So it is individual, yes? Depends on medical record.
It really depends on which arrhythmia are we treating. What is the patient like? What's the situation? We have general numbers which we can state. I mean, it depends if it's a first ablation, a second ablation, all this is, but in general, the prices are pretty competitive. The Canadian patient who was here this week, he got a cost estimate from the Cleveland Clinic and from the Mayo Clinic, and we were cheaper than the Mayo Clinic.
Wow.
And even though we're Switzerland and not the US. So the prices are competitive. However, I mean, it is a lot of money. The ablations cost anywhere between 15 and 50,000 Swiss francs, depending on the condition, on the ablation, because some ablations are super easy. They take 5 minutes and they don't need a lot of materials. And some other ablations are very complex. They take a lot of longer and they need a lot of materials, which costs a lot.
And what certifications and qualifications should patient look for when choosing a center for ablation procedure?
The first question to ask is, how many ablations has the person done who is going to do the procedure on you? That is the most important. Someone who doesn't do a lot of these ablations will not be able to provide good success rates. Then you have to ask him what he or the person says his success rate will be. If someone says 100%, run away, because then he's obviously lying. Ask about complications. See what kind of an honest answer you get. And these are questions which will help you go in the right direction. And then you need to get feedback from other patients, like Google reviews and statements from other physicians also.
Okay. And last question, why should patients choose the Swiss Ablation Center for their heart arrhythmia treatment?
It's an easy question. You see, here's the Swiss ablation. We only do ablations. We are a specialized clinic with highly professional people, a team who are concentrated and focused on ablation treatments. If you need anything else, we are the wrong people. We don't do everything. We only do this. I'm in here. We do the ablations of the heart, and for that we are the best.
Good. Thank you, Dr. Sacha, answering most common questions. I would like in advance to say thank you for people who later will watch this video in our YouTube channel, in our website. And if you still have any questions, feel free to text us on WhatsApp. And don't forget, we are here supporting you on your health journey. Thank you again, and have a nice day.
Thank you. Bye.
Thank you. Bye. Thank you.